introduce Supervisor Doug Chafee. He will have a few comments for you as well. Thanks so much. I'd like to start by thanking Andrew Doe. I remember when we were in Judge Carter's courtroom about 3 years ago, we were talking about these things, and it's your drive that got us here. So thank you for what you've been doing. It's my pleasure to serve on the Orange County Board of Supervisors and represent the 4th District. This year, I'm privileged to serve as chairman of the board. I also serve as chairman of the Commission to End Homelessness. My constituents are some of the most underserved and hard to reach. The renewed commitment to addressing community health through street medicine is a critical step in the right direction toward better patient care and, importantly, access. Caloptima is continuing to strive for excellence in Orange County's safety net health plan and to be a leader in deeply and positively impacting the foundation of healthcare for the vulnerable in Orange County. Caloptima is part of the Orange County Interagency Council on Homeless Healthcare, which was formed for the purpose of creating a street medicine program to provide healthcare on the streets for people experiencing homelessness. This is a critical partnership to addressing community health. Caloptima has already done a lot of work over the past 2 years to serve its population of members experiencing homelessness by launching clinical field teams and shelter-based services. But this is the next level of care. It's backpack medicine, with clinicians out in the field attending to immediate primary care needs. Street medicine puts care out into the community where it can be more effective in relieving their immediate needs and in potentially saving them from an emergency visit or hospitalization. The $8 million investment in launching a street medicine program comes at just the right time. As you know, Orange County just completed its point-in-time count a few weeks ago. We're waiting the results to learn more about our homeless population. Street medicine will be a fantastic resource to respond to our residents no matter where they live. Oh, I'm sorry, Isabel Becerra is our next speaker.
Good morning, everyone. It is my pleasure to be here today on behalf of the Caloptima Board of Directors, but also on behalf of the Orange County Healthcare Provider community. I represent the Coalition of Orange County Community Health Centers, and we represent 26 community clinic entities who are comprised of federally qualified health centers, federally qualified health center lookalikes, community freestanding clinics, and free clinics. They in turn operate over 80 locations throughout our county. They care for about 370,000 individuals and provide over 1 million visits per year. As such, our health centers serve thousands of Caloptima patients every day, so streamlining and speeding authorizations and payments will make a significant difference for all providers and including the safety net community. Investing in better automation and improved data sharing will have a major impact on the way community clinic organizations can interact with the health plan. And again, it's an unprecedented move based on the work that we've done in the past, and I can't tell you how excited we are to be able to have that point of care access to the data and to payment mechanisms. And apart from the technology you've heard a lot about today, I'd like to share sincerely how excited I am about the plan to launch street medicine in the county. Community health centers are frontline providers for individuals experiencing homelessness, and this population is at the heart of our mission, which is serving the vulnerable and the uninsured. Street medicine is a proven model for delivering primary care to people experiencing homelessness. By leveraging existing efforts such as the clinical field teams mentioned earlier, which are led by community health centers out in the field in partnership with the healthcare agency Caloptima and all of our CBOs, we will now be able to provide a more robust and comprehensive care model to those who need to improve, to those who need it the most, and will then improve our community's health. Street medicine is also designed to ultimately connect members to a medical home. that will be able to provide routine, ongoing care and prevent emergency care or hospitalization. This is what community health centers do day in and day out. The Coalition's Health Center members are proud to continue to serve in this capacity as medical homes for members identified for the program. Thank you so much. And I now turn over the mic to Dr. Chow.
Good morning, everyone. Thank you for being here. My name is Dr. Clayton Chow. I'm the Healthcare Agency Director for Orange County. As the Director for the Healthcare Agency, I am also really proud to have CalOptima as a partner to address the needs of our community's health. As you all know that I've worked for health plans before, I've not seen anything like this. Thank you to my colleagues on the Board of Directors of CalOptima. This is truly, as Supervisor Doe mentioned earlier, is a game changer because the agency, the entities, the community clinics, the community-based organization now realize that we cannot do this alone, and we can no longer function in silos because we're talking about the whole person health of individuals who are vulnerable in our community. It is sad to give you the figure of close to 900,000 people in Orange County who are a member of CalOptima, because it means that we have that many people who are vulnerable. And so we need to come together to do better to serve them appropriately. While CalOptima has other mobile healthcare services for members for the last 2 years, as Ms. Becerra pointed out earlier, street medicine is the first point of contact for helping individuals to get connected to ongoing services at the appropriate place, at their place. That's the most important piece, right? Because currently people who are unhoused waited until their condition is really bad, and then they'll show up to the emergency room. And so this is an attempt to really get people early, meet their needs as soon as possible, to ensure that their health condition don't progress to the point where not only it is dangerous for their own health, but also costly for the system. And I think Supervisor Doe mentioned that earlier. So the vision and the mission of truly for CalOptima is really take care of our member, but most importantly, our most vulnerable member, and those are individuals who are unhoused. CalOptima investment in technology resources will advance the county's connectivity, and we talk about that, right? In this day and age, if we don't use technology to communicate, if we don't use technology to exchange information about an individual, and many of our vulnerable individuals cross different agencies, cross different entities to get services. And if we don't talk to each other, we will never be able to see them as a complete person to provide the most appropriate and effective care. So better data exchange will help us see and support the needs of our vulnerable populations. So without the data piece of it, there's deep potential impact to social determinant of health and care coordination. So again, thank you so much for joining us today. At this time, to speak more about data, I'm going to pass the mic over to Mr. Wael Yunan.
Good morning, everyone, and thank you for being here. My name is Wael Yunan, and I'm the Chief Information Officer and Chief Information Security Officer here at CalOptima. Like the other speakers, I'm eager to announce that CalOptima is embarking on this mission, one that provides enhanced healthcare delivery to both our members and our provider partners. Over the span of the next few years, I've committed to working on a full digital transformation, including providing the same-time treatment authorization and real-time claims processing. This transformation will allow us to be better equipped to respond to our members' needs more quickly, prevent any delays in their access to treatment, and speed their path to healing. We also want to respond to providers' needs for streamlined claims processing, eliminating administrative burdens, and working with us, saving them time and money. One of the important elements of this transformation is that better collaboration within our community partners. We plan to break down the silos and exchange that data, developing interoperability for a health information exchange across county agencies. It'll allow us to address healthcare disparities and resolve some of the social determinants of health. As the pandemic has shown us over the past couple of years, healthcare is critical in the well-being of our community and must at times be delivered virtually. CalOptima will use technology to support that innovative model of care that uses predictive technology and data modeling to proactively identify health issues that can be prevented. We will also work to optimize the delivery of telehealth services, which are essential to some of our members. CalOptima will also be looking at replacing our care management system so that we can serve our most vulnerable moments and members with a focus on the whole person, considering both medical and social issues that occur with our members today, which will result in a healthy and thriving Orange County. We want our technology transformation to make it easier for members and providers to work with us, using tools like improved portals, chatbots, automation, AI, ML, phone-based apps. The future is now. CalOptima intends to be a leader in innovation and technology. When I joined CalOptima, I created a mission statement for my technology team months ago, and it was to be providing a best-in-class technology solution that enhanced the health outcomes for our members and the communities we serve. This initiative and the investment into technology and the investment into CalOptima, which in turn is an investment into our community, our providers, and our members, will help us to achieve that. I would like to thank Chairman Andrew Doe, Vice Chairman Clayton Corwin, along with all our board members and our CEO Michael Hunt for supporting this initiative and helping us to lead the way.